we'll be discussing abnormal uterine bleeding. Adenomyosis will also still be discussed in a separate lecture, but it is defined as the presence of endometrial tissue in any location outside the uterine cavity. Leiomyoma, which is fibroid, is the benign growth of the myometrium, and it is also going to be discussed in a separate lecture. Malignancy of any form in the genital tract can lead to bleeding. That is, malignancy of the cervix, of the vagina, of the uterus can lead to abnormal bleeding. Vaginal atrophy or prolapse can also lead to bleeding. A separate note exists for vaginal prolapse. In managing abnormal uterine bleeding, a careful, detailed history, physical examination, and investigation must be done to decide the cause of the bleeding. Then appropriate treatment is directed at this cause. Two important questions to ask in the management is that, one, is there a possibility of pregnancy in the woman? If yes, then a pregnancy test should be done. The second question is the bleeding pre-menopausal or post-menopausal? Bleeding in a post-menopausal woman is usually a pointer to malignancy and should be taken seriously. Some of the things to be asked in the history are as listed here: use of contraceptive, presence of abdominal swelling, fever, which may be a pointer to infection, abdominal pain, vaginal discharge, which may be foul smelling, and is a pointer to malignancy. Other things listed here should also be asked. The examination should involve checking for anemia, obesity or loss of weight, abdominal mass or tenderness. Speculum examination also should be done. Vaginal examination, including cervical excitation test, should also be checked. The investigations include pregnancy test to rule out pregnancy, hemoglobin level with PCV or full blood count to assess the level of anemia and to institute appropriate treatment is done. Ultrasound examination should also be done. Endometrial sampling should be taken for histology to determine if it is of endometrial origin. Hysteroscopy and MRI may also be indicated. The treatment of abnormal uterine bleeding may involve medical management, such as administration of medications that prevent bleeding or controls bleeding. Tranexamic acid is an antifibrinolytic agent which can be used. In people who have abnormal bleeding and pain too, mefenamic acid, which is an NSAID, can also be used because it doubles for pain control. A GnRH analog such as goserelin or buserelin can also be used. A combined oral contraceptive can also be used. An intrauterine system containing levonorgestrel, that is Mirena, can be used. For coagulopathy, that is deficient clotting factor, replacement of the deficient factor should be done, and this is usually done by the hematologist. Surgical treatment may include polypectomy, that is removal of polyp if a polyp is the cause. For fibroid, myomectomy. For endometrial CA or hyperplasia, endometrial ablation should be done. Hysterectomy can also be done if the woman has reached her family size. This is an illustration of assessing a woman for abnormal uterine bleeding. In conclusion, the causes of abnormal uterine bleeding can be structural, as we have discussed earlier, or functional. Proper evaluation and investigation of such woman can unravel the cause, which will aid treatment. In cases where the causes is not known, a diagnosis of dysfunctional uterine bleeding may be made, and treatment involves medical, surgical, or surgical intervention. Till next time, when we'll be discussing yet another important concept. Have a wonderful time.